Why are the long-term effects of infections uncertain? Imagine catching a cold or the flu and wondering what might happen weeks or even months later. Sometimes people seem fine, but others develop ongoing health issues. Why is it so hard to predict what will happen long after an infection? The main reason is that infections can cause very complex reactions inside the body. When a pathogen like a virus or bacteria infects someone, the immune system jumps into action to fight it off. But this response can sometimes go beyond what is needed, leading to immune problems like autoimmunity, where the body mistakenly attacks its own tissues. These issues can cause symptoms that last long after the initial infection is gone. Another challenge is that some parts of the infectious agent may stay hidden in the body. These hidden areas are called reservoirs. They can keep releasing small amounts of the pathogen, causing ongoing inflammation and symptoms. This makes it difficult to tell if the infection is truly gone or if it might flare up again later. People are all different too. Factors like age, genetics, overall health, and even sex influence how someone responds to an infection. For example, women are more likely to experience long-term effects like long COVID, which includes fatigue and brain fog. Because everyone reacts differently, predicting long-term outcomes becomes even more complicated. Diagnosing these long-term effects is another issue. Many symptoms like tiredness, muscle weakness, or neurological problems don't show up on standard tests like blood work or scans. Without clear markers, doctors find it hard to confirm or understand these ongoing issues, adding to the uncertainty. Viruses and bacteria can also change over time. They mutate, creating new variants that might affect the body differently. These changes can influence how long-term effects develop or how severe they become. This constant evolution makes it harder to predict what might happen in the future. Long-term studies are limited because many infections, especially new ones like COVID-19, have only been studied for a few years. Fully understanding chronic effects takes decades of research, and we are still gathering that data. Environmental and social factors also play a role. Things like access to health care, nutrition, stress levels, and other medical conditions can influence how someone recovers or develops long-term issues. These external factors add more layers of unpredictability. In the context of immunity and life cycles, understanding why long-term effects are uncertain helps us see that infections can leave lasting marks on health. For example, studies of SARS, a coronavirus related to COVID-19, show some people still have lung problems years after infection. To manage these uncertainties, health officials promote vaccination to prevent severe illness and long-term effects. Ongoing research aims to find better ways to understand and treat chronic symptoms. Doctors also monitor patients over time to catch and address lingering issues early. In short, the unpredictability of long-term effects comes from the complex immune responses, hidden pathogen reservoirs, individual differences, evolving pathogens, limited long-term data, and social factors. All these elements make it difficult to fully know how an infection might impact someone's health years down the line.